Hi, my name is Jillian Dombrowski, and I'm a junior at Stockton University. This presentation is for my aural rehab class, and the topic I chose to present about is auditory verbal therapy. Auditory verbal therapy is a specialized type of therapy designed to teach a child to use the hearing provided by a hearing aid or cochlear implant for understanding speech and learning to talk. So the child is taught to develop hearing as an active sense so that listening becomes automatic and the child seeks out sounds in life. So some more information and facts on auditory verbal therapy to get a better understanding of how this is different than other types of therapy is that auditory verbal therapy is learning through listening. It's not learning through visual cues. Auditory verbal therapy is providing clear speech. It's not speaking loudly or softly. It's providing natural language, not speaking with simple language. And in auditory verbal therapy, parents are teachers, not observers. And lastly, it's conversation-based, not drill-based. So those are just some differences between auditory verbal therapy and other types of therapy. So the stages in auditory verbal therapy: first, the child starts by assessing the ability to hear speech, either through hearing aids or cochlear implants. The child then learns to develop receptive language, which allows the child to understand spoken language. Once the child has a strong auditory and receptive language base, expressive or spoken language will spontaneously follow. So here's some listening environment tips for auditory verbal therapy, mainly for the parents. Speak close to your child's hearing aid or cochlear implant microphone. Speak in a quiet voice at a regular volume. Raising the volume of your voice can often distort speech, making it more difficult to understand. So it's important to keep a regular volume. Use a slightly slower speaking rate. Minimize all background noise, as in turn off any window air conditioner units, fans, TVs, radios, anything that could be a distraction. Use speech that is repetitive and rich in melody, expression, and rhythm. And lastly, you should use acoustic highlighting techniques to enhance the audibility of spoken language. So I found a few interesting facts. 1.6% of the 39 million school-aged children in the U.S. have hearing loss. So approximately 632,000 have a hearing loss. Hearing impairment is the #1 birth defect, but most hearing impairment children have useful residual hearing. So after reading these statistics, I feel that auditory verbal therapy can be very beneficial to so many children in many ways, especially since listening is a major component in the development of a child's personal, social, and academic life. Thank you.